Is your son a youth or high school baseball player with pain on the side of their shoulder when throwing? I want to talk about Little League shoulder, what it is, and how we go about identifying it. How do I know this? My name is Dr. Jeff Lewis, and I'm the owner and physical therapist at Lewis Physical Therapy and Sports Rehab in Point Pleasant, where I've helped countless baseball players get back to throwing pain-free, get stronger, and throw harder after an injury. Little League shoulder is a common overuse injury that I see in young baseball players, especially pitchers. It's technically called proximal humeral epiphysitis, which means inflammation or irritation of the growth plate at the top of the humerus, which is the long bone of your arm here. The growth plate is an area that continues developing and doesn't fully close until at earliest the age 16. Which is why this is a commonly injured area in our younger athletes. The throwing motion specifically places a significant amount of torsional stress on that growth plate, which can further lead to injury due to overuse or if the symptoms are not addressed properly. So again, why does this happen? Like I just mentioned, throwing a baseball, specifically pitching, places repetitive torsional stresses on that shoulder. Younger players that specialize in baseball from an early age, meaning they play for more than 8 months out of the year, or they've stopped playing other sports so they can focus on baseball pitching specifically, pitching without adequate rest or disregarding pitch counts are especially prone to this condition. Since the growth plate doesn't fully close until age 16 at the earliest, this is an incredibly vulnerable area when it comes to injuries. Often, factors like poor throwing mechanics, insufficient rotator cuff strength, insufficient periscapular strength, poor hip mobility, or poor thoracic spine mobility can further increase stress placed on the shoulder during pitching. How does Little League shoulder present clinically? So how do I see it present to me in the clinic here? Most common symptom of Little League shoulder is pain along the anterolateral, so the front side of that shoulder, not directly over the front, but the front side, or the posterolateral, meaning the back side of that shoulder with throwing. Some players might have some swelling that they notice along that proximal aspect of the humerus or even a palpable mass, decreased shoulder range of motion, pain with resisted external rotation. From a performance standpoint, there's probably going to be some type of decrease in throwing velocity or accuracy along with associated pain while throwing.